Congratulations! You've passed your OSCE. But if you think the hardest part is over, think again. Many overseas nurses quickly realize that real-life nursing, especially in aged care, can be very different from the exam. In this video, I'll share the common struggles overseas RNs face after OSCE and important things to consider before starting in aged care under the OBA pathway. Struggles overseas RNs face after passing OSCE 40 minutes to 2 minutes. Nurse looking stressed at paperwork. Busy aged care ward, multiple patients. Close-up of nurse communicating with elderly resident. A. Practical knowledge versus workplace reality. Even after passing the OSCE, many nurses feel unprepared for real-life scenarios. Policies, documentation, and patient handling can be very different from what you practiced in exams. B. Communication and cultural differences. Accents, slang, and communication styles can be challenging. Understanding residents and colleagues may take time. C. Workload and staffing challenges. Staff shortages and heavy workloads are common. You may have multiple residents to care for at the same time, which can feel overwhelming initially. D. Emotional stress. Feelings of anxiety, doubt, or being undervalued are normal. Adjusting to a new system while providing safe care can be stressful. E. Documentation and reporting. Local documentation standards like care plans, incident reports, and MAR charts may be very different from your training. Accuracy is critical. 3. Things to consider before starting aged care. 2 minutes to 3 minutes. Visuals, checklist graphics, nurse asking mentor questions, online training S. A. Workplace expectations. Research your facility. Understand staff ratios, policies, and workplace culture before you start. B. Support and mentorship. Ask if there's a preceptorship program. Having a mentor during your first weeks can make a huge difference. C. Legal and regulatory requirements. Familiarize yourself with RN responsibilities and OBA pathway obligations. Know what is expected in aged care. D. Continuing education and training. Be ready for additional online modules, competency assessments, and in-services. Lifelong learning is part of nursing. E. Personal readiness. Emotional resilience, patience, and adaptability are key. Starting a new job in a new country is a big adjustment. 4. Tips to make the transition easier. Here are some practical tips. Build strong relationships with colleagues. Teamwork matters. Observe and learn before taking on complex tasks. Don't hesitate to ask questions. It's better to ask than make mistakes. Document everything carefully. Accurate notes are life-saving. Join overseas RN communities for support, advice, and encouragement. 5. Conclusion and call to action, 4:30 to 5:30. Visuals, nurse looking confident and happy at work, uplifting background music. Passing your OSCE is a huge achievement, but your journey as an overseas RN is just beginning. With preparation, patience, and support, you can thrive in aged care and make a real difference. If you found this video helpful, don't forget to like, share, and subscribe for more tips for overseas nurses navigating their careers in Australia. Good luck and welcome to your new journey!